In the same stroke ward in Mumbai, two men lay in neighboring beds. Both were 60 years old. Both had weakness on the right side. Both could not speak clearly. Their brain scans looked almost the same. Their families heard the same words from the doctors. 1 year later, their lives are completely different. The first man walks slowly with a stick. He can eat by himself. He can use the toilet alone. He even works part-time at the shop near his home. The second man still lies in a bed in the living room. His wife lifts him, his son bathes him, his daughter feeds him with a spoon. He has never taken a single step on his own after that day. The difference between these two men is not luck, it is not some secret foreign medicine, it is not special genes. The difference is what their families did in the first 90 days after stroke. Today I want to make sure your family stands on the right side of this story. My name is Doctor Heartwise. I am a cardiologist. On this channel, we talk honestly about stroke and heart disease in India so that you can act before it is too late. If you want clear guidance for stroke recovery for Indian families, press like now and subscribe to this channel. Turn on the bell so you never miss these lessons. In the comments, tell me which city you are watching from and whether you or someone in your family is in stroke recovery now. Your story may help another family. Let us start with a hard truth that many people do not want to hear. There is no fixed timetable for stroke recovery. No doctor on earth can guarantee that a patient will walk in 3 months or speak in 6 months. Some patients improve a lot in a few weeks. Some improve slowly for years. Some do not recover function, even with hard work. But there is also good news. The brain is not a dead stone, it can rewire itself. We call this neuroplasticity. After a stroke, the brain enters a special period where it is more ready to build new connections. That period is strongest in the first 3 to 6 months and continues for about 1 year. If you use this window well, you can gain back movement, speech, and independence. If you waste it in bed at home, waiting for a miracle, you may lose that chance forever. I want you to fix one sentence in your mind. Recovery time is unknown, but your actions are in your control. You cannot choose how big the stroke was. You cannot change the scan from last week. But you can choose what you do from today morning to tonight. These choices repeated every day create the final result. Now let me give you a simple picture. Think of stroke recovery like climbing a long staircase. Some steps are small and easy, some are high and painful. If you stop climbing, the staircase does not come down to you. You stay where you are. If you climb steadily, even slowly, one day, you reach a higher floor. What decides how high you can go? There are 5 big factors. I want you to listen carefully and think about your own family. First is the severity and location of stroke. If a large area of brain tissue has died, recovery is naturally harder. If the stroke has damaged the main movement center or speech center, the journey becomes long. This is the reality. But even in severe strokes, early movement and therapy often bring surprising improvement. Do not use severity as an excuse to do nothing. Second is the physical condition of the patient before the stroke. Was the person active or sedentary? Did they have strong muscles or very weak legs? Were they overweight with joint pain or reasonably fit? The stronger the body was before the stroke, the more reserve it has for recovery. This is why I always tell healthy viewers on this channel to move their body today. You are building a reserve for tomorrow. Third is the list of medical problems marching beside the stroke. High blood pressure, diabetes, heart rhythm problems, high cholesterol, smoking. These are like heavy stones tied to the legs of the patient. If they are not controlled, the patient feels tired, sad, and unmotivated. Sugar swings make stamina worse. Uncontrolled pressure risks another stroke. Recovery cannot happen well on top of chaos. Regular follow-up with the treating doctor and strict medicine control are not optional. They are the foundation. Fourth is the power of family support. I do not mean only lifting and feeding. Support means patience and encouragement. In some homes, the family shouts at the patient. Stand up. Move your hand. You were so strong before. Now look at you. These words cut deeper than any surgery. They push the patient into depression. In other homes, the family claps for every small step. They say, "We saw your fingers moving more today. We are proud of you. The exercises are painful, but we are with you." Same stroke. Different atmosphere. Very different results. The fifth factor is the most important and the one you can change starting today. It is the speed and quality of rehabilitation. Rehabilitation means all the therapies that teach the brain and body to work again. Physiotherapy for movement and balance, occupational therapy for daily tasks, speech therapy for talking and swallowing, psychological support for mood and motivation. The earlier and more consistent these start, the better the recovery curve. Right now, I want to ask you to check something. If your family member has come home after stroke and is lying mostly in bed with only casual movement and no structured therapy, you are wasting the golden window. Pause this video after it ends and make phone calls to arrange proper rehabilitation. If this message feels important, press like so that YouTube shows it to more Indian families who are lost after discharge. Now, I will give you a simple roadmap for the first year after stroke. This is not a guarantee. It is a guide so you know what to focus on in each phase. Phase 1 is the first 7 to 10 days after discharge. The main goal here is safety and prevention of complications. Make sure medicines are taken exactly as prescribed. Check blood pressure and sugar as advised. Set up the bed so that the patient does not fall. Turn the body regularly to prevent bed sores. Even in this early phase, do not treat the patient like glass. With supervision, they should sit up on the side of the bed as early as possible and move the arms and legs within safe limits. The message to the brain should be very clear. Work is not over. Phase 2 is from the end of week 1 till the end of the first month. This is when real rehabilitation must begin. Daily or at least frequent physiotherapy sessions are essential. The therapist will start with basic movements. Rolling in bed, sitting balance, standing with support, shifting weight from one leg to the other. If there is speech difficulty, speech therapy must begin now, not 6 months later. If the patient is sad, withdrawn, or crying often, do not ignore it. Depression after stroke is common and treatable. Ask the doctor about counseling or medication. During this phase, many Indian families make a big mistake. Because progress looks slow, they reduce therapy or stop it. They say, let us wait till the patient becomes stronger. In fact, strength comes because of therapy. Stopping now is like stopping an antibiotic after 1 day and then blaming the medicine. Phase 3 is from the second month till about 3 months. By now, some pattern of recovery is visible. Maybe the hand is still weak, but the leg can bear some weight. Maybe speech is coming back, but memory is slow. The goal of this phase is to convert exercises into real-life activities. That means standing at the sink and washing the face, stepping from the bed to the chair, holding a cup with supervision, saying full sentences slowly. The therapist and the family should work together to set small, realistic goals every week. For example, by the end of this week, the patient will be able to stand for 1 minute with minimal support. Write the goals on a paper in the room. Celebrate when each one is achieved. Phase 4 is from month 4 till month 12. Progress is slower now, but it still happens. This is the time to rebuild independence. Climbing a few stairs with support. Using the toilet. Walking with a stick on even ground. Helping with light household tasks. Many patients and families become tired by this stage and stop pushing. They say whatever was possible has already happened. In reality, the brain is still learning. Stopping all effort here locks the patient into a lower level of ability for the rest of life. Next, I want to talk about a topic that makes me angry as a doctor. That is false promises and miracle cures for stroke. In almost every Indian city, there are people who claim to cure paralysis with special oil massage, herbal pills, or secret injections. They guarantee that the patient will walk in 30 or 60 or 90 days. They ask for large advance payments. Families who are frightened and desperate feel tempted to try. Please remember the story of the 2 men in the ward. The first family spent their energy and money on structured therapy with trained professionals. The second family spent most of theirs on unproven miracle claims and ignored daily rehabilitation. The result is visible 1 year later. I am not against traditional methods that are safe and supervised. But anything that asks you to stop medical treatment or promises a fixed recovery time is a red flag. There is no single medicine that can replace months of guided practice. Before you take any treatment, always ask yourself one simple sentence. Does this add to our rehabilitation or distract us from it? Keep your focus on long-term function, not short-term emotion. Now let me give you a compact checklist you can use after this video. You can replay this part many times. Number 1. Understand that recovery time is individual. Do not compare day by day with other patients. Number 2. Control blood pressure, sugar, and other risk factors tightly. They are the soil on which recovery grows. Number 3. Arrange early and regular rehabilitation, including physiotherapy, speech therapy, and psychological support. Number 4. Create a positive environment at home. Measure progress in small steps and praise them. Number 5. Stay away from anyone who guarantees cure in a fixed number of days or asks you to stop standard treatment. If this roadmap and these warnings make sense to you, type the words "we will not waste the window" in the comments. That sentence is a promise to your future self. Also tell me which phase of recovery you or your family member are in right now. I read these comments and they help me decide what to cover in future videos. Share this video with at least 3 people. 1 family member, 1 friend, 1 colleague. You never know who is secretly caring for a stroke patient at home and needs guidance. Stroke recovery is not a straight line. There will be days when you feel nothing is changing. There will be days when a tiny new movement suddenly appears and fills the room with hope. Do not judge the journey by one bad day. Judge it by your consistency over months. This is Dr. Heartwise. My work is to give you clear, honest information so that your family can make strong decisions in the worst moments of life. If you have not yet subscribed, press subscribe now and turn on all notifications. Together we will build a new culture in India where stroke does not automatically mean a life in bed. Thank you for watching, and I will see you in the next video.